HIV/AIDS cases are rising fast. In the last decade, the number have grown at an alarming rate. But why is this happening?
One reason is lack of awareness. Many people don't know enough about HIV, how it spreads, how to prevent it, and why testing is important. Because of getting fear and stigma, some avoid getting tested or seeking help.
Another reason is weak healthcare access. Some places, especially far provinces, have few clinics or clinics. Even in cities cannot afford treatment, medicine exists, but not all can get the medicine.
Poverty is also a big factor. Many struggle to meet basic needs, so health often comes last. Some turn to risky jobs or behaviors just to survive, increasing their chances of infection.
HIV/AIDS is not just a health issue. It's a crisis that affects communities, families, and the future. The fight isn't just about medicine, but also about education, support, and action. The time to act is now.
HIV/AIDS in the Philippines is spreading fast, but how did it start and why is it getting worse?
HIV was first recorded in the Philippines in the 1980s. At first, cases were few, but over time, the numbers grew. In the early years, most cases were from overseas workers who got infected abroad.
HIV spreads in many ways. First, unprotected sex, the biggest reason. Many don't use protection or know the risks. Second, sharing needles. Some drug users share needles, making the virus spread fast. Third, lack of testing. Many don't get tested, so they don't know how they have HIV. This leads to more infections. Fourth, stigma and fear. People are afraid of judgment, so they avoid doctors and treatment.
In the last 10 years, HIV cases in the Philippines have more than doubled, while other countries have slowed down infections. The Philippines is one of the fastest growing in the world.
More people need treatment, but hospitals are full, meaning wait too long for doctors or medicine. Some clinics don't have enough HIV specialists.
Not all hospitals have enough supplies. Some patients travel just to get treatment. Others stop taking medicine because they can't afford it.
In some areas, clinics are too far or too expensive. Those in small islands or remote places have few choices.
HIV/AIDS affects more than just health. It changes lives. First, some lose jobs because of discrimination or sickness. Second, young people with HIV struggle to continue education. Third, many feel ashamed, alone, or hopeless. And fourth, some fear going outside because of stigma.
The United Nations, through the World Health Organization, plays a key role in fighting HIV/AIDS worldwide. In the Philippines, where HIV cases have been rising, WHO has been active in leading efforts to control the disease.
World Health Organization provides clear and advice on how to prevent and treat HIV. They help the Philippines government create strong health plans and ensure that people know how to protect themselves. World Health Organization has supported introduction of pre-exposure prophylaxis, a medicine that helps prevent HIV infection. This approach is part of a broader strategy to reduce new infections.
The United Nations brings together countries and groups to share resources and knowledge. In the Philippines, this means working with local communities to improve HIV testing and treatment. One success story is the Sundown Clinic in Quezon City. This clinic offers friendly services to those risk of HIV and has become a model for others.
In 2018, the Philippines passed a new law to strengthen its response to HIV/AIDS. The law expanded access, testing, and treatment, especially for young people, who welcomed this move, noting it addressed critical challenges in the country's HIV program.
AIDS is not over. It is one of the deadliest pandemics of modern times.
I have learned that I am not alone in this fight. I also hope that in the Philippines, in the near future, young people will not be afraid of HIV anymore.
Through guidance, support, and collaboration,
the United Nations continues to make a positive impact on the fight against HIV/AIDS in the Philippines.